Atkins, Secretary of State for Health and Social Care, is with us this morning. Good morning.
Good morning.
It's good to see you, Secretary of State. Your boss yesterday said that he felt that the NHS and waiting times had not made as much progress as he'd hoped. What would you say in response?
Well, look, he chose those 5 priorities, knowing full well that they were going to be tough to achieve. And we've made fantastic progress on the very first priority, halving inflation, more than halving inflation, and growing the economy. But we know that these priorities are not easy to achieve. Now, as Health Secretary, I'm completely focused on these waiting lists, and we have seen in the last 4 months waiting lists reduce, which is even in the context of industrial action by junior doctors. But we will not stop there. And today we are really pleased to announce that we have met our ambition to roll out 160 sites across England which will be offering tests, scans and checks, community diagnostic centres they're called, because we know that diagnosis can be clearly critical in ensuring that people get the treatment they need as quickly as possible. But of course there is more to do, and I promise you every single day I'm focused on this with laser-like focus, because I do not want my constituents, my friends, my family waiting for treatment times, and I don't want anyone else waiting as well.
Yeah, but you acknowledge what the PM has said there. Do you agree with him?
Well, I think, look, I still think there's plenty to do. And I think, the work that we have coming down the line, we're going to have, a little later today, we'll have the official statistics dropping. I'm not allowed to talk about them at this point because they're embargoed. But we will see the much more focused and nuanced approach we're taking to waiting lists. So we know, for example, that there are some trusts that do not have long waits. They do not have 78-week waits and so on. And so we're trying to spread best practice across the country to help those trusts that are struggling with those longest waits.
OK, I mean, just as an aside, my sister has a very virulent form of breast cancer, and the NHS has been spectacular in looking after her. That's not a free hit, it's just a fact, but it's not always the case all across the country.
So the NHS looks after 1.3 million people a day. The scale of this is vast. We have 74,000 people entering A&E each day in February, for example. And so, of course, individual stories are really, really important. They are what keep me awake at night. It's what drives me to, do better every single day. But we should also acknowledge that a lot of people do get good care on the NHS, and I do worry sometimes that with the understandable focus on me to ensure that standards are met and maintained, that sometimes we lose the good news stories as well, or the stories where people have been really helped by the NHS.
Why is Julian Assange still being held in Belmarsh?
Because the agreement with the US stands as it is. I'm not as close to the detail as I used to be when I was in the Home Office, but he will be being held there quite lawfully under a warrant, and so there will be discussions between the two countries as to his status. I know that President Biden has said something recently, but that, to be honest, is something that the Home Secretary will be dealing with.
He says President Biden. He says the US is considering dropping the case against him.
We can't act on a considering basis. There would have to be, and there will be, I'm sure, continuous negotiations between both countries, not just about Julian Assange, but a whole range of matters.
And the Australians getting involved as well. The Australian Prime Minister saying, it's enough now, you need to let him go.
Well, as I say, that will be a matter for the Home Secretary, but clearly
to keep him. When he was at the Ecuadorian Embassy, I think it was something like 17 million pounds. But it is 5 years since he's been in Belmarsh. He should only have, his bail conditions were only for a year. The last 4 years he's been in Belmarsh, and now's the time to let him go, says the Aussies. He
will be being held there lawfully, but that will be a matter for the Home Secretary to deal with his international coverage.
You've also talked about the Cass report. Will the government accept all 32 recommendations?
Yeah, there has been a culture of intimidation and ideology that has trumped safety and evidence for the care of children. This has to stop. It will stop. And I'm looking at every single one of those recommendations. Nothing is off the table. And in fairness, we have already acted by closing down, for example, the Tavistock Clinic at the heart of all this, and also opening up new services across the country, very much incorporating the holistic view that Dr. Cass talks about in her report. Rather than treating these children as a a condition. We want to treat them as people, as human beings, look at all of their conditions and try to help address some of the complex needs that came out so well in her report.
Labour said they would adopt all 32 recommendations.
Well, Labour has spent the last 10 years trying to shut women up when it comes to this. They have been part of the ideology, the culture wars, talking about, creating an atmosphere of intimidation for anyone who dared to question this ideology. So it is a little bit rich of the Labour Party to be lecturing the rest of us now, having been so forthright in their support for this ideology in the past. Look, I'm looking at every single recommendation. I must give a formal response, but I promise you I'm looking at this with great sympathy and with determination. And what is more, in the last few weeks alone, NHS England has banned the prescription of puberty blockers for children and young people. That is absolutely right. I'm also looking at what we can do to stop people trying to get these medications or these drugs overseas, as well as the very understandable questions that have been raised about private clinics as well.
Talk to me about rough sleeping before I let you go. The government doesn't have overall support from your own party, given some of the hogwash that we've seen in the Justice Bill suggesting that people who smell should be arrested. I mean, it's ludicrous.
And it is not what is in the bill. We want to help the most vulnerable in society. We are investing £2.4 billion to eradicate rough sleeping, and we have been very, very clear. What we're trying to target are those criminal gangs that make a living out of intimidating people. We want to stop some of the aggressive begging that can happen around cash points, for example, but we do not and will not criminalise people who don't have a home. Absolutely not. That is not what this bill is about. And I'm very much looking forward to us.
You're aware of the original phraseology and wording, and that's going to be changed.
That we are absolutely not criminalising people who cannot, who are sleeping on the streets because they do not have a home. What we want to do is support them into supportive accommodation, because again, many people who are living rough have complex needs, and so it's not just a question of getting a roof over their head. But they need mental health support. They may have been victims of horrendous adverse childhood experiences in their time. There are real vulnerabilities here that we want to support, and this is not about criminalising people who are homeless. OK, we're out of time. We could talk all day. It's good to see you. Thanks very much indeed for taking the time to join us. Thank you.